Lectures from the Academy. Welcome. My name is Chrissy Dawn, and for the next few minutes, I'm going to share with you a lecture from the Blue Heron Academy entitled, Aging is Not a Disease. This presentation is one of a series of lectures selected from the many classes taught by Dr. Gregory T. Lawton to the students of the Blue Heron Academy of Healing Arts and Sciences from 1980 to 2022. Dr. Lawton founded the Blue Heron Academy in 1980 as a free school for women in transition who were victims and survivors of rape, incest, and domestic assault. Since that year, thousands of students have learned the practice of true traditional health care at the Academy and have gone on to establish practices serving the healthcare needs of their patients. Dr. Lawton is a licensed chiropractor, napropath, and acupuncturist, as well as a certified naturopath. In this podcast, we will look at how we can plan to stay healthy during the long course of our lives, because aging is not a disease. I began teaching classes on addiction, including alcohol addiction, in 1969 as an assistant instructor at Lake Michigan Community College. I also worked for the Berrien County Drug Rehabilitation Center during the same time, and my role was to travel throughout West Michigan and provide presentations on drug and alcohol abuse and addiction. I have worked in and around drug and alcohol addiction for over 50 years. I am the author of an anti-drug coloring book for children, and I practice alternative and holistic medicine because of my opposition to the widespread overuse and abuse of pharmaceutical drugs in conventional medicine. In the lecture to follow, I will briefly review how aging is not a disease, does not have to lead to disease, and what the real causes of disease are. Aging is not a disease. Becoming sick, ill, and weakened by poor lifestyle behaviors is what leads to disease. Infection also causes disease. Aging does not cause most diseases. It is your lifestyle that can cause disease and accelerate the aging process. Most people would be capable of living into their 70s, 80s, or possibly even their 90s without serious degenerative disease if they simply changed their lifestyle behavior. For many years of my practice of healthcare, I taught this fundamental truth. Aging is not a disease. While it is true that eventually, if you live well into your advanced years, some joints will show wear and some organs will begin to fail, it is possible to live most of your life without degenerative diseases and the limiting pain and disability that comes with degenerative disorders. Your familial genetics and your lifestyle are the determining factors in terms of how your body ages. And of these two factors, by far, your lifestyle choices related to diet, nutrition, drugs, and alcohol are the most important determinants in whether you live a long, healthy, and happy life or not. If you are suffering from pain, the primary causes are diet, alcohol or drugs, obesity, and chronic systemic inflammation. Systemic inflammation is the root cause of many diseases, including most joint disease, heart disease, and many cancers. I cover the topic of chronic systemic inflammation in my booklet, The Role of Inflammation in Aging and Disease. By their fourth decade of life, alcohol drinkers will begin to show obvious signs of rapid aging. By their fifth decade of life, the average drinker will show significant aging of their skin, hair, nails, and joints, and may present with a biological age 10 to 15 years beyond their chronological age. If they are 55 years old by physical appearance, they may look 65. Alcohol causes cellular stress and death, and that is the biological definition of aging. The so-called health benefits of alcohol are attributed to the same nutrients found in grape juice and other fruits and vegetables. There is no positive health benefit to alcohol whatsoever. The alcoholic content in a glass of wine is not the chemical constituent of wine that is beneficial. It is phytochemicals found in grapes, such as its antioxidants and polyphenols. including resveratrol and various flavonoids that provide positive health benefits. Keep in mind that drinking any type or amount of alcohol can cause damage to the heart, brain, nerves, liver, and other organs of the human body. And it can cause high blood pressure, high blood triglycerides, and increase your risk of developing several cancers, including esophageal, stomach, and bowel cancers. Any amount of alcohol increases the risk of gastrointestinal cancer. Alcohol is absolutely contraindicated for anyone with esophagitis, gastric reflux, gastritis, stomach ulcers, pancreatitis, Crohn's disease, irritable bowel disease, and diverticulosis or diverticulitis. Recent studies published in the mainstream media will no doubt result in a significant backlash from moderate drinkers, as well as the beer, wine, and liquor industry. You will probably begin to see the media carrying more stories regarding the amazing health benefits of alcohol. Don't believe it. Their intention is to sell more alcohol and to confuse the issue to the point where no one is certain of the truth. Alcohol has been and remains the number one drug problem in the United States and worldwide. As stated previously, alcohol is only one factor in the degenerative disease process. The Standard American Diet, SAD, is the cornerstone upon which most degenerative diseases are established in the human body. If you want to stay healthy, if you want to live long and enjoy life, follow a diet and a lifestyle plan based upon plant nutrients, vegetables, fruits, and large amounts of whole grains, seeds, nuts, and legumes, or what is classified as complex carbohydrates. Food is not only your medicine, but also your life. Think that it is difficult to make positive changes and to follow a healthy lifestyle? Try living with a debilitating disease or chronic pain. For many people, serious illness or pain creates a teachable moment where they realize that they are responsible for their health and not the doctor. Some people come to this realization in time to make changes and to live a healthy life. Others do not. In my classes at the Academy, I teach, once some things are broken, they cannot be fixed. Not every disease or disorder can be cured. Degenerative diseases, especially of the joints, can create lasting, disabling damage, and an artificial joint is a poor substitute for your natural knee or hip joint. Some years ago, I was riding a bus to school in Chicago. I was sitting on the back of the bus, studying for an exam, and eating a multigrain peanut butter and honey sandwich. The bus stopped to pick up a passenger, and it seemed to take a very long time for the passenger to get up the steps of the bus. I looked up from my physiology textbook and watched as a woman in her late 50s was struggling with great difficulty and obvious pain to get onto the bus. She had to come up the steps backwards because her knees and hips were so diseased that they would not flex normally. Her back was bent into a bent kyphotic hump, the result of osteoporosis and arthritis, no doubt. The moment that I looked at this woman, a thought came into my mind. The inconvenience of living a healthy lifestyle is nothing compared to years of pain and suffering due to disease. Americans are experiencing serious degenerative diseases earlier and earlier in life because of systemic inflammation, obesity, and diabetes. A person acquiring these diseases in their 40s may have another 4 or 5 decades of life ahead of them. That could be years of pain, medication, surgery, and a disease that limits your ability to do things in life that you love with the people that you love. Aging is not a disease, and how you age is entirely up to you. Think that it is difficult to make positive lifestyle changes? Think again. This has been another in a series of podcasts based upon lectures from the Blue Heron Academy. I hope that you enjoyed this podcast and will return for more of our upcoming presentations. Thank you for your kind attention, and stay healthy.